Hello, this will be a very short discussion about Pemphigus. Now, what is Pemphigus? It is a skin disease in which there is blisters in the skin, and it is an autoimmune condition. That is, the body produces antibodies against its own cells. So it is an autoimmune condition in which there are blisters that form in the skin, and also mucosa. Now we'll come to all of that soon. Firstly, we have to understand the structure of skin. So this will be a very rough diagram. So this suppose this is the epidermis. We'll have the stratum basale here. I won't be drawing the whole thing, just to show or to make it understandable. So this will be the stratum basale. Okay, that is the stratum basale, and on top of that we have the stratum spinosum. We have the polygonal cells, that is the stratum spinosum. This basically is the squamous epithelium that we are talking about. And on top of that we have the stratum granulosum, where the granular layer, granules are formed. And if it is the palms and the soles, there will be a stratum lucidum. But if it is not, there won't be a stratum lucidum. So we have to know that the stratum lucidum is seen only in the palms and the soles. In other areas there is no stratum lucidum. And on top of stratum lucidum we have the stratum corneum. I'm not drawing it as a cell, but to understand, the top layer is stratum corneum. Then we have lucidum if it is a thick skin like a palm or sole. Then we have the stratum granulosum. Then we have the spinous layer, stratum spinosum. And in the lowermost layer is a stratum basale. Stratum basale is the layer where cell divides, and after it divides, it will go up, it will grow towards top, and gradually after the stratum corneum it will be shed. So this is the basement membrane. So the whole thing is sitting on the basement membrane. And this is the dermis. Basically, more specifically, this will be the papillary dermis, since it is finger-like. It's like finger-like. If you look, it is a finger-like. So that is why it's papillary dermis. The entire thing from stratum basale to stratum corneum was epidermis. What is below the basement membrane is dermis, and the topmost part is the papillary dermis. Then below the dermis we have subcutis. So anyway, we are more concerned with the epidermis as far as pemphigus is concerned. So in pemphigus there will be a division of cells, that is, the acantholysis will be there. That is, if the cells are together, bound together, this is what you call, I'm just drawing it as stratum spinosum. So the cells will be bound together, and once this adhesion between the cells is lost, they will get rounded up. So that is what you call the acantholytic cells. And that is because if you look here, if you take a close-up of this part, there will be the cells, two cells will be bound together by what you call desmosomes. And if you look here, the basal layer will be bound to the basement membrane by hemidesmosomes. So I have already told that this is an autoimmune disease in which there is autoantibodies. It is a type 2 hypersensitive reaction where the body produces antibody against desmosomes. So these desmosomes, they have many components, extracellular as well as intracellular. Among that, the extracellular most important ones are desmoglins, and the desmoglins are further divided into 1 and 3. So this is a basic understanding. And when there is antibodies that are produced against desmoglins, the cell to cell adhesion is lost and acantholysis occurs. So now let's go. All the images that are shown here are from Robbins, and after this there will be a virtual slide which is from Path Presenter website. So this is from the first chapter. If you look, this is the basement membrane, where is below. Yeah, this is the basement membrane, already is marked here, basement membrane, and the cell, the basal cell is bound to the basement membrane by hemidesmosomes, seen here, and the cells are bound to each other by desmosomes. If you go this desmosomes. So when there is any defect in desmosomes, the cell to cell adhesion is lost, and when there is any problem below, that adhesion there is also lost. So this is from chapter 1, which we have to understand to know the whole thing completely. So when coming to Pemphigus, acantholysis is the main feature. Anyway, this again is a figure from Robbins. So as already told, we have a stratum. This is the stratum corneum, which has a basket weave appearance. Then this is the if you look here, there is just below the corneal layer there is splitting of the skin or the epidermis. That is, there is a splitting between the corneum and the layers below it. So that is a subcorneal splitting or a blister. And here, if you look, this is the basal layer and this is the other layers. These are the other layers. So just above the basal layer there is splitting. This hemidesmosome too has no problem. That is, the basal layer is very firmly attached to the papillary dermis, but above the basal layer there is blister formation. So that is what you call a suprabasal splitting. And here, if you look, it is a subepidermal split. The whole entire epidermis has split up from the papillary dermis. This is seen in bullous pemphigoid. This is seen in Pemphigus vulgaris. This is seen in Pemphigus foliaceus. First one, seen in Pemphigus foliaceus. Okay, so those are images from Robbins. Now this is another very interesting image which will help us to understand the pathology better. As already told, desmosomes have components called desmoglins, and in case of epithelium, that is skin epithelium, the desmoglins are, desmoglin 1 is more on the layers above, and as you go down, desmoglin 3 is more in proportion. So desmoglins are more in proportion to desmoglins in the lower layers, and in the upper layers desmoglin 1 is more. And in case of mucosa, squamous mucosa, like if you take the example of oral mucosa or esophageal mucosa, it is desmoglin 1 is very less. It is almost entirely composed of desmoglin 3. So the importance is, when we have antibodies against desmoglin 1 produced by the body, the splitting of the layers will be more in the upper layer. So it will be more of a what do you call as Pemphigus foliaceus will have more of a antibodies against desmoglin 1, and desmoglin 3, if you have antibodies against desmoglin 3, the lesions will be more of mucosal, because mucosa is completely means oral and esophageal mucosa, as if we take an example, are composed totally of desmoglin 3, so they will be affected. And if there is antibodies against desmoglin 1 as well as 3, there will be extensive effect. It will be affecting that person extensively with both mucosal as well as skin lesions. So if you look, this is the desmosomes. So when the cells attachment is lost, they'll just this polygonal shape is lost and they'll get rounded up. We'll see that soon. And here we have the hemidesmosome below. Where is it? Yeah, here. Right. So this is a great image which shows the distribution of desmosomes in the skin. Remember, in the mucosa it is more of desmoglein 3. Now pemphigus, before going into all that, we have to know pemphigus we can divide into 5 types mainly. Pemphigus, that is first is Pemphigus vulgaris. Vulgaris means common, and doing justice to its name, vulgaris is indeed the most common of them all. And under Pemphigus vulgaris another also comes, that is Pemphigus vegetans. In Pemphigus vegetans, it is blisters are very less, and it's more of a warty lesion. That is why that is like vegetations. So that's why it's called Pemphigus vegetans. It is actually a type of Pemphigus vulgaris. In histologically, it looks like Pemphigus vulgaris, but there will be proliferation of the epidermis. Then we have Pemphigus foliaceus, in which the bulla will be on the just subcorneal bulla. And another variant, there are 2 variants of Pemphigus foliaceus. One is called Pemphigus erythematosus. Pemphigus erythematosus. It is called Pemphigus erythematosus because the distribution is very similar to lupus erythematosus, that is a malar area. So it is called Pemphigus erythematosus. Then another we have is Pemphigus, Fogoselvagum. Fogoselvagum is basically Pemphigus foliaceus, but it is seen in Brazil, that part of the continent, as an endemic lesion. That is, it is the endemic form of Pemphigus foliaceus seen in the area of Brazil is called Fogoselvagum. So that is 2 of them are over. Now we have drug-induced Pemphigus. Then we have IgA Pemphigus. Then we have paraneoplastic Pemphigus. So those are the types of Pemphigus. Again, I'll just say Pemphigus vulgaris, Pemphigus foliaceus, drug-induced Pemphigus, IgA Pemphigus, and paraneoplastic Pemphigus. Among them, again, the vulgaris has another form called vegetans. Foliaceus have other 2 forms, erythematosus and Fogoselvagum. Right. So we'll go more into it. So this is again an image from Robbins showing a suprabasal bulla with inflammatory infiltrate. This is a bulla, what do you call a bulla? That is a split has occurred here, and there is a bulla formation which has some fluid maybe. And this here in the inset, what you are seeing is acantholytic cells. That is, the cells are more rounded up and separated from each other. So that is the acantholytic cells. If you look here, this is showing a mucosal lesion in a patient who has Pemphigus vulgaris. This is another lesion in the leg of a patient. You can see that this skin has just gone, means after this the blister has occurred, and the epidermis above has denuded away. And this is a very characteristic feature that you see in Pemphigus vulgaris, that is the fishnet-like appearance, or means the body has IgG antibodies are produced by the body against desmosomes. So surrounding the cells you have, when you do a direct immunofluorescence against IgG, there will be immunofluorescence around the cells, around each cell, and together it will show a fishnet like appearance, what you use to catch fish. So this is a fishnet like appearance that is very characteristic of Pemphigus vulgaris. Now we'll see the microscopy in a virtual slide from path placenta. Where is it? Yeah. So this, if you look into it, we can see, I don't know, it's very clear. Wait 1 minute. So this, I'll put a low power first. See, this is a skin. We can see that there is a bulla formation here. Now first we'll look into the normal area to appreciate the whole thing better. Now we'll just go into the normal area. Yeah, this is a good place. Just put it in highest power. If you look, this is what you call the stratum. This is the stratum basale, then the stratum spinosum, granulosum, then this is the stratum corneum, and this is what you call the basket weave appearance of stratum corneum. This is orthokeratosis. Now we'll just move a little bit into the lesion. Here we can see the first sign usually is there will be intercellular edema, that is the cells will be separated more from each other. If you look here, the cells are very closely packed, but if you look here, the cells have a more of a separation, that is edema is forming between the cells, and that spinous layer is getting expanded, means like what you call stretched up. If you look here, the cells are separating from each other. So the intercellular edema is among the first features that you can find. And as you move again, you can see that edema has increased and the cells have almost separated from each other. See, you can, if you look closely, you can see some spines of the spinous layer. So that's the spines, and it is almost completely stretched, and you can see it is the edema fluid is all around. So, and another thing is that that polygonal shape is almost lost, and the cell is almost like rounded up. And as you go further, here the whole bulla has formed, and this is basically the beginning of a blister formation. And the blister, when more and more of blisters form, it will find a result in a bulla. And if you look here, these are the acantholytic cells in the bulla. Like if you see here, let me see, I'll put a high low power. Yeah, here somewhere. Right. If you look here, see the cells have all separated from each other and have more of a rounded appearance. So that polygonal shape is lost and the cells are more rounded. So they are called acantholytic cells. That is, the cells are separated from each other. That is, acantholysis has happened, and they are called the acantholytic cells. So again, looking into low power, into the lesion proper. If you look, see, there is a blister above here, and we have already seen the acantholytic cells, and there is some kind of secretion here. This is the spinous layer, and if you look more into a higher power, this is the papillary dermis, and the basal layer is attached firmly to the papillary dermis, and that is why you have a tombstone like appearance here. The cells, the basal layer is completely intact, and that is why you have a tombstone appearance, and the bulla is above that basal layer. So that is why you have the suprabasal bulla, and this is what you call the tombstone appearance. That is like tombstones, they are like tombstones. Okay, so this is and if you look into the dermis, there is a lot of perivascular infiltrate of inflammatory cells. Now again, going back just to show what the acantholytic, means tombstones are. Suppose this is the basement membrane. We have the intact basal layer that is appearing as tombstones. That is why it's called tombstone appearance. Okay, thank you. Let's